Hey guys, Dr. Nixon here. Today I want to walk through how to actually rebuild bone density. So listen, if you've ever been diagnosed with something like osteopenia or osteoporosis, you'll want to pay attention to my next health tips to really overcome osteopenia and osteoporosis. The reality is that your bones are actually living cells, just like all the other cells in your body, and you can actually rebuild bone density. So my number one health tip to actually reverse something like osteopenia or osteoporosis is to actually rebuild bone density by using something called vitamin D3. So vitamin D3, we refer to it as a sunshine vitamin because naturally the way our body creates vitamin D is really through sunlight, direct sunlight with our skin. So obviously I'm not trying to, say get sunburn, but actually to expose yourself to sunlight. What we know is when the sun hits your skin, your body goes through a process converting cholesterol derivatives into vitamin D3. So if you've ever had a blood test that's maybe shown that you had low vitamin D3 levels, especially if you're dealing with low bone density, you want to increase that. My recommendation, personally, I do somewhere between 5 to 10,000 units of vitamin D3 on a daily basis. If you have osteoporosis or bone density issues, I certainly recommend talk to your medical provider, talk to your doctor, have them run your vitamin D3 levels, see where you're at, and you want to get those numbers up higher because what the research shows is that vitamin D3 helps build strong bones. So that's key number one. Key number two is actually consuming dark leafy green vegetables. And the reason why is you're trying to get vitamin K, specifically vitamin K2, into your body. What the science and research shows is actually vitamin D3 and vitamin K2 work synergistically. They work together to actually build bone density. And you'll learn one of my big things is to actually use food first. So I'm a big fan of getting as many nutrients as you can from food. And so vitamin K comes from dark leafy green vegetables. So that's step number two. Step three, we use this currently in our practice and in my office. We use whole body vibration therapy. So you may have seen this more recently in the news or on the different health shows. Whole body vibration therapy, the research is showing that it stimulates what's called osteoblasts. So in school, the way I remembered this was osteoblasts build bone. And so by stimulating the osteoblastic activity in your body, you can rebuild bone density. And my last step, and a lot of medical providers in the research would show that this is a great next step, is to do some sort of weight-bearing exercise. And so maybe that means for you, maybe it's walking around with, some small hand dumbbells, maybe a pound or 5 pounds, doing some sort of load bearing or even weight bearing exercise. You add stress to your bones, and then your body, in its infinite wisdom, the way God created it, it just goes ahead and starts stimulating more bone growth because it wants to be stronger. And so, again, if you've been diagnosed or concerned about osteopenia or osteoporosis and low bone density, follow those top 4 steps. Step number 1, vitamin D3. Step 2, getting vitamin K into your body through leafy green vegetables. Number 3, whole body vibration. Find a provider or a chiropractor or someone who can provide that specifically for you in a safe environment. And step 4, load-bearing exercise helps stimulate those osteoblasts. Hey, again, this was Dr. Nixon from Twin City Health.